Greetings and welcome to the Asia Society Policy Institute Center for China Analysis webinar on Healthy China 2030. Healthy China 2030 was the first ever national health plan introduced by the Chinese government, and it's been around for about 10 years now. But we haven't seen a lot of really good information about the obstacles that the government faces in achieving the goals from the Healthy China 2030 plan, and not much of an assessment of how they've made progress so far. So we've assembled a really terrific panel today to discuss this and to hopefully learn more. We have from the Council on Foreign Relations, Yanzhong, who is today in Beijing. We have Liu Chang, who's the CEO of ASK Health Asia and an honorary fellow here at the Center for China Analysis. And we have Winnie Yip, who's professor of the practice of global health policy and economics at the Chan School of Public Health at Harvard. Also joining us is Patrick Beyrer, who is a research associate in public health here at our center. And my name is G.A. Donovan. I'm fellow Chinese Society and Political Economy at the Asia Society Policy Institute. Now, of course, China is a vast country with an enormous population. It faces a number of problems currently. Demographically, the population is rapidly aging. There are still regional disparities between the relatively wealthy coastal areas and parts of the interior that are still lagging in development. There's a mismatch between the availability of healthcare services and the demand for them. And as I mentioned, the Healthy China 2030 and other policy initiatives by the government are designed to hopefully help develop the country's healthcare system to be more fit for purpose for the population and better meet their needs. So I want to jump right into the questions now. And the first one, I'd like to ask Yanzhong, if we go back to when Healthy China 2030 was introduced back in 2016, what was happening at the time? What prompted the government to develop this plan in terms of the specific challenges?
Well, thank you, GA. It's a pleasure to speak with a stellar group of experts on China's healthcare sector. So Healthy China 2030, essentially they aim to cut the non-communicable diseases mortality by 30%, raise life expectancy to 79 by 3 years from 76, and ensure the equitable care by 2030. So essentially responded to a lot of challenges, including urbanization, aging, population aging, inadequate healthcare systems. So they want to make health a strategic pillar for China's so-called Xiaokang, a moderate, prosperous society and modern future. If you look at the non-communicable diseases, the initiative was launched when China underwent a profound epidemiological transition, where you have chronic non-communicable diseases replacing infectious illnesses as the primary health burden. By 2016, NCDs, non-communicable diseases like heart disease, diabetes, cancer, accounting for nearly 87% of all mortality, and then you look at the population aging, in the meantime, China's population was aging quickly, right? Projections indicate that the elderly population would triple by mid-century. So this demographic shift coincided with this concern in lifestyle factors, risk factors, including rising obesity, widespread, tobacco use, by the decreasing physical activity levels, by the associated with rapid urbanization. But in the meantime, if you look at China's healthcare system, it faced its own structural challenges, even with the advances in insurance coverage, right? More than 95% of the population covered by some kind of health insurance. The system remained, right, hospital-centric with, underdeveloped primary care. So there are also deep rural-urban disparities in healthcare access and quality. Out-of-pocket expenses also created financial barriers for many people seeking care. Not to mention, this is also the time China faces the environmental challenges, sort of complicated this landscape. Severe air pollution, water contamination, food safety issues also impact public health. So, Healthy China 2030 was launched, when China was facing this perfect storm of NCDs, demographic shifts, environmental threats in 2016. So they want to address these challenges sort of set the stage, for its later initiatives, the 2025, that's weight loss plan, so that shows some continuity in tackling one of those increasing health burdens in China. Thank you.
Very good. So, Professor Yip, do you have a view of how it's going so far? What improvements have there been in the last decade?
So if you look at the indicator that China has highlighted as their sort of monitoring 13 or 14 main indicator, well, first of all, I want to point out that those indicators are actually very highly correlated with the global set of indicators for UHC, universal health coverage. Now, if you look at the sort of government statistics on that, I would say that those indicators are pretty much on track. And in fact, for some of them, China has already achieved the goal by 2023, 2024. So, for example, let me just share with some of the numbers with you. For example, for infant mortality, the goal for 2030 is 5%, 5 per 10,000, and China has already reached it to be 4.5 by 2023. Other numbers like the number of physicians available, that also again has already been achieved. Other measures on clean water, clean air. Then the rest of them, like infant mortality rate, life expectancy, I would say they're very much on track. But I think that behind these indicators from government official statistics, I think there are still a lot of barriers. In particular, if we do analysis on how well has China progressed in terms of prevention, disease management, and also health outcome for non-communicable diseases, China is not making as much progress, right? So if you put that into groups, maternal mortality, life expectancy, even infectious disease, great progress. And I would say in some cases, even exceeded. But if you look at the larger group of things, which is like non-communicable diseases, not as much progress. And then other kind of indicator, which is more input-based, like physician, beds, money spent, again, all those are very much on track. And I think that is reflecting, as Yanzhong has already alluded to, that China's healthcare system is still very hospital-centric. Primary healthcare is still very weak. And despite, I would say, 15, 20 years of saying that, I mean, even the state council would come out and say primary healthcare is the most important, that progress hasn't been as great. And we should spend some time to discuss why. And so then if you look at another indicator, which is the percentage of the household that is still exposed catastrophic health expenditure. Remember China's healthcare reform that started in 2009? It was going to address two major problems, 看病难, 看病贵. And among Chinese colleagues, they would agree that maybe after 15 years of reform, 看病难 has sort of resolved, but 看病贵 is still a problem. And if you look at, objective empirical analysis, in fact, in the rural area, the percentage of the household that is exposed to what we call catastrophic health expenditure, in fact, depending on the method and the data, some of them show no improvement, some of them show that it has gotten worse. So the question is why? So I think we're focusing a lot on how much money has been put in, but I think one fundamental challenge China is facing is the rapid healthcare cost growth. And the focus of the healthcare expenditure concentrated in tertiary hospital, not even hospital. Yeah. Because we just recently do an analysis that's now taking 63% of the total health expenditure. And I think that's going to be all underlying why the progress for non-communicable disease is not moving that far. So I actually see the Healthy China 2030 a little bit like a continuation of their 2009 health reform. And it's really this I really applaud it, right? I mean, it's really saying that let's change the system from a disease system to a health system. And that's really the great change that China was trying to introduce. And it's really continuing to commit on that path. But the actual movement to that is seeing quite a field of barriers. So I'm going to pause here for now.
I'm being on. It's difficult to get medical care. 看病贵, it's expensive to get medical care. And Liu Chang, as Professor Yip said, they've seemed to have made some progress on the difficulty, not really with the expense. But what do you ascribe the progress that Professor Yip just described? What do you ascribe it to? How has the government managed to achieve some of these goals even before their deadline? So where has the government invested the resources, and what have they done to achieve these things?
Great. Thank you, GA, and greetings from the sunny Lake Como, Italy here. To everyone, really great pleasure to join the panel discussion with distinguished fellow panelists, Professor Yip and Professor Huang. So I am the founder of Ask Health Asia. We started operating in China about 10 years ago, 2015, right before the Healthy China 2030, right? So have been mostly based in China and have a team there with about 30 people at the think tank for the last 10 years. So also trying to sort of provide that inside out sort of perspective as the China Center is really trying to offer. So I think what Winnie, Professor Yip just mentioned is really some of the outcome and indicators in the last 10 years, right? Like 9 years of the progress made in Healthy China 2030. Maybe I would take a little bit more from the health system pillars, more like structural measures approach in commenting on the governmental investment. In China, I think usually we say 三一, 医疗, 医药, 医保. So that's basically healthcare service, health financing, and healthcare medical products and regulatory. So that's also have related sort of governmental institution sort of on it, right? GA, you just asked about which sort of sector the government is investing the most after the launch of Healthy China 2030 strategy. So I think in terms of monetary or infrastructure investment, certainly I think still the majority of the resources go into the service delivery system. But as Winnie pointed out, I think still a lot of that going to tertiary health and also sort of more higher tiered hospitals. So I think the direction they set is clear in building more distributed healthcare delivery system and also promoting the system integration among different levels of healthcare system. But I think a lot of the sort of more bigger investment that happening still on the higher level institutions, right? So that in the last 6 years, I think they highlight the 2 centers development, 双中心, which means the national medical centers, which are mostly on the top cities. They want to build national top centers in the specialty disease area, but also potentially building the global sort of championship level of sort of excellence and center of excellence, and also to develop national regional medical centers, which sort of usually in less sort of resource heavy areas, but those are still big hospitals, and they want to leveraging the resources in more developed area to connect with those less developed area infrastructure development. But again, as mentioned, it's still a lot of those are like high level tertiary hospital that developing and investing. And another area, I think, in the service delivery side that they're putting resources are on the service integration. Certainly, I think now the models in cities, which they call the coalition, the medical coalition in the cities, and also in rural areas, the medical consortium, which is even higher form of integration, is still piloting and happening and evolving, and a lot of investment go into that area. But sometimes the comment is it became sort of almost like a funnel to let big hospitals to access to the other care sort of patient flow in the communities and in that region. So become sort of even making the whole healthcare delivery more concentrated in the top tier hospitals. So that's sort of I think, infrastructure investment they have been putting. But I really want to highlight and comment on the other big investment the Chinese government made, which I think is really great progress. And they're putting a lot of political resources in. It's on health financing. I think after 2030, the Healthy China 2030 plan launched, I think the biggest regulatory shift certainly is establishment of the National Health Security Bureau in 2017, 2018. And I think with that, it's not necessarily putting a lot of resources, monetary resources, but really trying to create a much stronger purchaser to leveraging the strategic purchasing, both to service delivery as well as to medical products and drugs and devices into sort of disrupt sort of the current system. But I feel the last maybe 6-7 years when after the bureau established, they're still in their phase 1 in sort of crushing down the cost and maybe starting the payment reform. But I think in terms of how the payment strategic purchasing be able to assist on the higher level long-term objective of Healthy China 2030, I'm hopeful in the next few years that to come. Yeah, so I'll stop here.
And now for Professor Huang, Professor Yip, Patrick, do any of you want to add anything about what you think sort of the 1 or 2 most important things that the government did, either in terms of investment or resources or policies to achieve the progress that has been made so far?
I think in the last few recent years, which actually is controversial now, one of the major policy China has introduced is the bulk purchasing of drug and the negotiation of drug prices. Now, whether it has gone a little too far, it is up to discussion, and we still need more empirical evidence. But I do think that the previous structure of which you have so many multiple layers of drug distribution, which inflated drug prices, and also each hospital, each region go and procure a drug and therefore are not able to get a low price. With this establishment of the National Healthcare Security Administration being able to do, in essentially it's national bulk purchasing, I do think has been very powerful in reducing drug prices. And if I do, and when I did some of the interview, and patients feel that these drugs are much more available and affordable now. And then, of course, recently you have heard that there are also tertiary hospital physicians who come together and wrote a note to say that some of the quality is bad. And of course, I think that we should examine that. I'm not saying it's a perfect policy, but if you ask me to point out one big policy, I think that was impressive and it is positive. The second policy that is actually pushing very hard, but I don't think is making much progress, is what Chang Liu has been saying, is trying to build what they call integrated delivery system. Right. So the idea is to build these people-centered integrated delivery system, focus on primary healthcare, keep people healthy. The reality on the ground is that we're seeing more of the sort of integrated delivery system like the United States, of which the big medical center integrate downward, but then actually more of the patients is actually attracted upward. So, and this is about systemic issues, and which we can come to that because it's a bit complicated. One is I would point out is that the capacity at the primary care level is weak. People don't want to go there. And with all the roles that is being built, with all the overtime expectation, people do want to go to the big hospitals. But then on the supply, on the provider side, big hospitals basically is using these primary care clinics as their antenna to help them attract patients. And I do think what China do need to change is how the National Healthcare Security Administration pay the hospitals. The current payment is create incentive for the hospital to want to be even bigger and bigger and bigger. And I'm just going to stop here because I do think that is critical.
Well, I'd also I'd like to add the environmental health regulations that are included in the Healthy China 2030. In the document, China sort of juxtapose the environment and health as equally important. The government strengthened air pollution control through the Air Pollution Prevention and Control Action Plan. They implemented more stringent industrial emission standards and accelerated the transitions away from coal. In the meantime, we're seeing water safety regulations and soil contamination control measures were tightened to address the environmental health risks. And so far, I think they have made good progress in improving the air quality in China. I mean, Beijing can tell, right? It's the progress has been significant, right? The blue sky days have increased, but the smog, it's still an issue, but we're seeing significant improvement in air quality in Beijing nowadays.
Thank you both. And I want to turn to Patrick now. I'd like to bring us up to the current moment. And Patrick, I know you were following the two sessions and other recent political meetings very closely. And you were the one who pointed out to me that this is the Li Qiang's government work report mentioned the health first strategy. And this was the first time this had been mentioned by the very senior most Chinese leaders. So can you tell us a bit about what you've been seeing and the messages coming out of Beijing, and a little bit about the health first policy?
Absolutely. Thank you, GA. So I think the health first strategy is Beijing's response and recognition to what Professor Yip was talking about before, that there is a weakness right now in China's primary healthcare system in terms of disease management and prevention, and the health first strategy might be a temporary salve to getting in that direction. So to even just translate the health first strategy, which is the 健康优先发展战略, uses very similar terminology and familiar terminology that will I think light a lot of memories for health observers in China. 健康优先, which is health priority, health first, it can be translated that way as well, is the same language that's been used in Healthy China 2030 since its release in 2016 and used at the national level, but it's never been formulated as a national action plan. That is a new strategy that has been adopted since the Central Committee passed a resolution approving the Health First strategy in July 2024. At the time, National Health Commission Director Lei Haichao said that the health first strategy would anchor China's goals nationally, become a healthy country by 2035, while speeding up reform areas, especially in regards to early disease prevention, screening, regional healthcare disparities, balanced layout, and medical care coordination with insurance, which are all primary healthcare and preventative healthcare measures I think Beijing is struggling with grappling with. And although the health first strategy is mentioned just once at the top of the health strategy section in the government work report, I think it does deliver on a vision that China has for coordinated governments of medical service insurance, according to a report. But what is that verbiage, which is very party speak? What does it actually mean in practical implementation? In my view, I think that the health first strategy is a way of presenting the same objectives Healthy China 2030 has for many years, but giving authorities more cover to implement these sort of strategies on the preventative health side at the grassroots level. For example, at the end of the two sessions in a National Health Commission study group, Director Lei Haoqiao said that the health first strategy would be critical to promoting public welfare, solving regional health disparities, and even trying bulking up and building capacity for regional healthcare centers, like Professor Yip talked about, as not just being the antenna attracting patients in, but also being a pathway to actually caring for those patients at those centers. So I think we need to look for going forward is that the health first strategy being a grassroots implementation strategy for a lot of national officials, and look how it might be able to complement existing social trends too, which I'm excited to talk about with a lot of the panelists here. China is not just grappling with preventative health measures that include non-communicable diseases and disease prevention, as we traditionally think of it, but emerging crises and challenges with obesity and weight management, as well as mental health. And health first is, I think, a response to those strategies as well, and grappling on to both social sentiment and social media trends that the national, I think, government is very attuned to.
Thank you, Patrick. Professor Yip, Patrick just mentioned that one priority currently for the government is addressing these rural health disparities. And you mentioned earlier that you thought that one of the biggest challenges was how to improve the delivery of primary health care. I wonder if you could talk about a little bit about those two issues and how they may be related in terms of sort of dual challenges that alone are hard to solve, but together are really difficult to solve.
Right. I mean, it is a challenging problem, especially with a lot of urban-rural migration as well. So first of all, I do think that the Chinese government care about equity, at least in the area of health. And I do think it is a commitment to equity. But of course, that is the underlying motivation for that, I think, are twofold. One, I think, is more value-based. And it started as early as the 2009 reform, because I really see a lot of these changes, policy is really starting from 2009, that major big reform. And you know that before 2009, China took a very market approach to its healthcare system. 2009 is a big turning point to say, no, equity is important and social and economic development need to be balanced. So I think that continued to be carried until today. And therefore, it is a priority for the government to see more urban-rural equality. So I think that is a real motivation. But the second reason is also a bit more practical. If you don't improve the healthcare in the rural area, people then just go and flock themselves to the big hospitals. China knows that is unaffordable. It is expensive. So from a practical perspective, it is important to improve the capacity and also the quality in the rural area and at the primary care level, so you can actually really have more patients flow down to that level. And I think that a major barrier for building primary healthcare and building primary healthcare in rural area is human resource. So some of the current thinking and strategy is to say, well, let's attract more physicians to go back to practice there by giving them better monetary compensation. I personally think that will not work. Because just think about someone who have gone to medical school, been socialized in an urban area. I mean, I've done so many interviews. They said, I want to find a spouse in the urban area. I want to raise my family in the urban area. So I think that China should think more about leveraging AI technology. However, primary healthcare is not just technology, it is also the human face. But I think China should really be training a lot more what we used to call community health workers and nurses, and paying a lot more attention to the personal aspects of care, because successful primary care means that the patient trusts the provider. They always want to go back to this same person as the trusted person. And I think there is hope, but it really would need to change from more of a physician focus to a more allied health kind of focus strategy. But I also think that Chinese population now somehow only believe that big hospitals are good quality. I do think there needs to be some public education for the rural population and in general, the Chinese population in general. And I do think that, I think this is also synchronizing with recently not so much talk about anymore, but I still think it is within the Chinese strategy of the rural revitalization strategy. You have to build up the social sector for the people to be willing to go back to the rural area to build up the economy. So they're all intertwined. It's not just about healthcare. It is also about development as well.
Thank you. Thank you. Professor Huang, another focus at the moment seems to be health insurance. How does that fit into the government's plans and its current priorities?
Well, I think this renewed focus on health insurance in Premier Li Qiang's 2025 government work report highlights China's priority to strengthen, I won't say priority, actually incentive, but to strengthen its social safety net amid this economic decline and the demographic cliff, right? So this comes as, state-sponsored insurance schemes like the urban and rural resident basic medical insurance have been significant, right? I have seen a significant unsubscription, 25 million fewer enrollees in 2022 alone. That is like a dropping from 1.36 billion in 2021 to 1.34 billion. In the meantime, we're seeing premium soaring by 38-fold since 2003, from 10 yuan to 380 yuan. In 2023, that actually outpaced income growth, particularly for rural and low-income groups. In the meantime, the benefits for joining this insurance schemes remain limited, with low reimbursement rates and high co-pays, sort of driving, social dissatisfaction. So this trend reflects a broader challenge for the government, that is how to maintain public trust in a system struggling with rising costs and inequalities. So the government's recent response, including this proposed 30 yuan per capita subsidy increase, aims to boost affordability and coverage, reversing these opt-outs and addressing disparities, and that signals intent to reduce medical impoverishment, unlock household spending, and support domestic demand, which we know is a key to economic resilience. And that trend also aligns with the Healthy China 2030 strategy by prioritizing health as a foundation for national stability amid an aging population and economic uncertainties.
Thank you, Liu Chang. I want to ask you for your view. We're talking about the need to balance. The government feels there's an acute need to balance social and economic development. How well, in terms of looking at this through the lens of the healthcare system, how good a job do you think they've done so far? And what are the one or two things that they could do better?
I do see some hopes. I think, especially in the last few years, the policy direction, at least for both the financing side and also for, I think maybe later I can highlight another one, focus on supporting industry development. I think that's also one of the elements in Healthy China 2030 as well, in the broader health sector as an industry in developing. But I think back to the main one of the main comments, I think everyone, all the experts was discussing about the concern and the sustainability challenges for the basic medical insurance layer, given population aging and economic sort of growth uncertainties, but also given the huge regional disparities, right, between rural and urban, and also between the more developed coastal area and then the inland area. So I think that really created a huge challenge so the basic medical insurance the reality is they can really trying to focus on equity and covering the basic. But in the meantime, I think the aspiration in many parts of China, and also I think certainly for the governments, is the common prosperity, right? So they're demanding for higher quality, for more choices. So I think that sort of has been, I think, an ongoing struggle, especially on the financing side. But where I see hope is even in Healthy China 2030, the government in financing stated a clear direction in building a multi-layered healthcare security system, which they have been putting that as a very, very high priority since last year by the central government, especially by National Health and Security Administration. I think the idea is to continue work on the equity for the basic medical insurance layer to create that sort of more unified benefit package across the entire population, while strengthening the other two layers, which are sort of the supplementary commercial insurance for sort of the middle class and people who have more means. But the benefit package is on top of basic medical insurance, so it can be integrated back to the basic medical insurance layer. Well, there's another sort of layer, which is charitable donation and also other like mutual insurance funds that hopefully to induce additional redistribution for gradually enhancing the depths of UHC in the rural and the less developed area. So I think that's sort of a more integrated approach and much more clear messaging in policy direction that the government has been putting since last year. But again, it's already in the text in Healthy China 2030, but I think now they put that into a very systematic sort of matter. And in National Health Security Administration, they have a term called 1+3+N, which leveraging one single unified healthcare information system for payments. And the 3 are the basic insurance layers, and the N are all the supplementary layers that will be integrating with the basic insurance layer. So I think that's sort of one area I really feel is a very important pillar to ensure the success of the entire healthcare system, not only going back to basic, but really promoting that continued development and growth. And the second example I just want to very quickly highlight is on regulatory. So I think it started with the regulatory reform in drug registration, which I think another big development progress made in the last few years. Now they basically upgraded that into what's called a full chain of support for innovative drug industry in China. So that I think since last year, the central government is starting to clearly trying to leverage in the entire value chain from basic scientific research, clinical development and research, drug registration, financing and investment, health insurance and access, that's the multi-layer financing, and also price management. So all the sort of parties work together, even beyond the 3 health-related ministries, in providing more continuous support in developing innovative industry. So I think that's sort of another area I think is a good example in how the government is trying to sort of focus on balancing the sort of challenges in healthcare system versus the aspirations in a broader economic growth and society concern. Yeah.
Liu Chang, do you see space for the global or overseas companies, whether in the healthcare industry or in the insurance industry or other industries, do you see space for them to participate in the initiatives you just described?
Absolutely. I think for the maybe for medical device and the drug side, I think there are more and more open policies in terms of regulatory, clinical research, as well as in financing that really open opportunities for not only for the local innovative life science industry in benefiting from, but also the global innovative products. And at the same time, I think most of the global leaders that we see operating in China, they are also benefited from the infrastructure in innovation developed here in China. So a lot of sort of business development and sort of commercial partnership that they have developed with the local innovators in China in bringing some innovative products for global, right? In the end, it's really we're trying to develop global products for serving global health needs. But I think beyond the medical device and drug industry, in health service delivery, I feel there are also growing opportunity. That really, again, another major policy launched last year is to allow in piloting area, fully owned foreign invested healthcare service company to invest in hospitals, right, and other service providers. And also even in some specialized area like cell and gene therapy, they're also opening up the policy for foreign investment. So, but I think not only on the hospitals and the therapies, but also I think the private sector will certainly have a very strong role to play in that service delivery model transformation aspired by the Healthy China 2030, which Professor Yip and Professor Huang mentioned, such in like prevention, in care integration, even in elderly care and silver economy. I think those are the potential areas of opportunities for global leaders.
Thank you, Luo. Does anyone else have a view they'd like to share about the commercial side of China's healthcare reform?
I would agree with Dr. Liu. The private sector has a huge role to play in terms of improving international cooperation between Beijing and the rest of the world on drug development and on disease management going forward. Government-to-government cooperation right now, I think, is very uncertain as the current administration in Washington takes shape. And policies in China right now are very much geared towards welcoming back foreign investment in the pharmaceutical and biotechnology sectors to the country. And I think the leadership has been very attuned to this over the last couple of years. So in addition to the policy that Dr. Liu just highlighted, which was fantastic, the foreign wholly owned pilot policy going through 9 cities and regions right now. Previously, foreign companies and institutions were only limited to joint ventures or having Chinese partners or having to have some sort of special approval to manage those hospitals in the past. There's another policy that I would put out there that's very worth discussing, which is a 2025 action plan to stabilize foreign investment put forth by the State Council every year. There are versions of 2024 and 2023 that also adhere to a lot of focus and language on welcoming back biotech investment, and even included some major industry players in terms of drafting and industry consultation, which I think is a huge step. But the 2025 plan actually even alludes to the pilot policy on foreign hospital ownership. So I think this just shows how much equity and political stock Beijing is putting in this policy as a way to welcome back foreign investment, capital, and resources. And this is already, I think, taken shape at the China Development Forum this year as that goes on now. The reports are still coming in as we speak, but the amount of biotech firms and pharma firms that have caught wide-ranging attention from the U.S. and other Western countries in attendance appears to be much larger than last year. And this was accompanied too by a USD $2.5 billion investment from AstraZeneca into a research and development center in China. They're second in China, they're 6th in the world. So I think companies are now seeing China not just as a place they can go in to the market for China, for Chinese consumers, but as a staging ground and platform for research and development that's connected to the rest of their global products. Geopolitics in this area, I expect, will become fairly difficult over the next couple of months, but I think it's very clear from my perspective that companies are looking to not just get involved in China for Chinese products and Chinese consumers, but use it as a platform and also to monitor Chinese competition, as we've seen with the Akeso DeepSeek moment, as it's been called, with their lung cancer clinical trials beating out the results of Keytruda, which is a popular medicine here in the United States. U.S. companies and Western companies are starting to realize that Chinese pharmaceutical innovation has been there for many years. It was latent, but now is really coming together as a serious competitor. And I saw an article from the Wired China only a couple days ago that reports the amount foreign firms have spent on acquiring Chinese drug pipelines reach an all-time high 2 months into 2025. So I think it's very clear that M&A activity, out-licensing deals, for all that from the foreign business perspective, is only going to increase, at least in terms of interest, over the next couple of months.
Thank you, Patrick. Professor Yip, I wanted to turn to you and ask you about your view of these kind of international collaborations that Patrick described, and also China's global health partnerships, and how China has leveraged those to help it advance its healthcare policy goals, or its reform goals for its healthcare system. Yeah.
Right. So let me first of all point out that I think China is facing serious trade-off between health policy goal and industrial policy goal for the kind of investment that we're just talking about. I mean, the recent promotion on wholly foreign invested hospital is an example. That is really the government's policy to try to attract more foreign investment, of which health is a sector. And why is there tension? The tension is, on the one hand, from a commercial and industrial policy perspective, China wants more foreign investment, more technology, and even engagement. But I think from a health policy perspective, China's current problem is that its healthcare expenditure is growing really fast. And that's why the health insurance is having to face, it's getting to the top priorities because it is so expensive that it cannot continue to fund whatever new services that is available. And that tension becomes, where do we draw the line that is funded by this basic public insurance policy? What should be given to the market? And that's why China will open up the private insurance market, I'm quite sure, because by necessity. The question is, how do you open it in a way that doesn't deviate from the original intention of equity too much? That doesn't fall into the problem of the private insurance, insuring the more expensive product and therefore driving up the cost. I actually think that will be a major, major tension and trade-off that China is going to confront when we talk about more investment in the technology and new product, etc. And I think it would be worthwhile to really look at what are the innovations and new technology that is cost savings. What are the new innovation and technology that are cost growing? And that would really help solve this tension a lot more. And definitely a lot of the health policy is very much closely linked to economic policy. And I'll just go back to even why the attention to the social security, the health security, the health insurance. Health insurance is sort of the pathway to security. Security is what the government wants the people to have so that they would not save so much money and therefore use it to stimulate internal consumption. That link is very, very clear on the top policy leaders' mind, right? Right now is all channels that would stimulate internal consumption would have to be explored. And having people feeling that you don't need to be feeling insecure about health expenditure is one of the channel. And I think those are connected as well. In terms of collaboration, my observation is that from the researchers, academics perspective, they really welcome and they really sincerely express there's a need for collaboration, for mutual growth. So I see global partnership to continue to have the demand, but I think it's going to vary by the field. Anything that is technology related is just going to be hard. Let's just face it. Anything that is outside that, I think there's lots of opportunities, because my interaction with researchers, and I would say even senior government officials, they understand that China wants to continue to learn. China wants to continue to engage. There's no question about that. So I'm quite positive about that. And in addition to collaboration in research, in discovery of science. I actually think that collaboration on what we call the softer science, which is policy science, how they develop their policy, the exchange of experience, the science of how they develop their healthcare system, is really going to be quite important, and it's mutual. And I personally think, and I think that the Chinese, our Chinese colleagues would welcome is they still welcome a lot of training. And I do think training is important because training is really the most neutral vehicle to put our mindset on a more level playing field. And that really is the first step for collaboration.
Thank you. Thank you. Professor Huang, so we've heard today, we've discussed the achievements that China has made in the past decade. We've talked about some of the difficulties and challenges that remain. So if you had a crystal ball and look into it, what do you see as the direction of travel here? What can we expect between now and 2030?
Yeah, I wish I had a crystal ball, but I think my educated speculation I think my guts would tell me that the momentum, for some of the major, healthcare reform measures in China will be growing modestly. But that progress, will be. I won't see much fundamental change, although the progress will be steady, but it will be partial. If you look at the insurance coverage, right, likely the out-of-pocket cost may drop. With broader NCD, the disease burden, and there could be increase of the rural coverage and benefits, but that shallow benefits likely will persist, without much broad investment. If you look at the NCDs, they're likely going to cut the mortality, but I'm not confident whether they're going to see reach the 30%, the goal. The obesity trends are likely going to be stabilized, but my guts tells me that it's unlikely to fundamentally change by this, rural rich and the lifestyle shifts lag. Life expectancy likely to increase. It may achieve the targeted 79 years old, driven by better urban care and the pollution cuts, but rural gaps will remain. We're going to see some baseline progress, that increased life expectancy, NCD drop, right? The improved insurance coverage, right? But it may still fall short of the lofty goals as laid out in the Healthy China 2030 document. I expect the momentum, is going modestly, and it's more likely going to be evolutionary, than transformative. Most of these major challenges, NCDs, population aging, disparities will sustain. If you look at the population aging, I think the problem is going to get worse. By 2030, the expectation is that more than a quarter of the population will be aged over 60. There's, so far, I don't see any significant change in the political will to significantly increase in the healthcare sector. That fiscal, caution, I think, will continue to be a challenge for China if they want to achieve, fully it's the Healthy China 2030 goals.
Thank you. Thank you. Liu Chang, I want to ask you, how do you see things developing over the next 5 years? How do you gauge the prospects for the success of the Healthy China 2030 initiative when the time is up?
So for me, I feel it's quite. I think it's very hopeful. Since last year, there are also new leadership in the two most important administrations, right? The National Health Commission as well as the National Health Security Administration. So I think both of them actually, for instance, the new minister in National Health Commission is with a health system background, and I think he's very, very focused on sort of that delivery model transformation of primary care. So I hope in his terms that he will also have personal drive, right, make some big shifts for the system transformation. Well, I think the National Health Security Administration, this is the second sort of administration bureau head so I think this also demonstrate sort of not the second sort of phase of health financing reform in that sense. So I believe in the next few years, there will be significant momentum that being developed. We have already starting to see sort of at least policy directional sort of progress in both ministries. And lastly, I think for industry development and also for global collaboration, I feel now even the State Council, as Patrick mentioned, is putting more direct derivative and influence. That because I think those topics really requiring multi-ministerial collaboration. So I think that's really, really great to see some even top-level attention on some sort of long-term topics that now among the government leaders that are putting their coordinated sort of efforts.
Thank you. Thank you. Professor Yip, do you see this momentum building with more high-level attention to these issues now?
I do, and I would say that what I expect to see is that China is going to be vigorously pushing the scaling up of the Sanmin model. It has been on the agenda for many years, but I'm seeing a lot of very active actions. And what is the significance of that is if you look at Lei Haitau's announcement, one key is they have to reform the compensation system for the public hospital doctors, because that is really a root cause for them to want to do more expensive stuff rather than to really refocus on improving people's health. So I think there will be a lot of action in that. The other action that is related to this reform is we talk about the National Healthcare Security Administration, the NHC, and there's also other ministries that are related to health. I think one of the fundamental problems that they're facing is the governance structure, right? These different ministry sort of make their own policy. They don't really come together to talk about what is the common goal. And I think what Sanmin's model was able to do is to create an overarching structure to bring them together. I think that is another area that you will see that China is going to push vigorously in the next coming few years, because until some of these things are changed, the rest of the delivery is like being locked in the current situation, and you can't really turn that big ship from a treatment model to a population health model system, which is really what Healthy China 2030 is about. All the other indicators is just a outcome to see whether we have changed from a disease-based to a population health-based model.
But that's hard. It's hard to do what you described, changing the governance model.
Let's see. It's not changing the governance model. It's changing to have better coordination, right? So, in fact, if you read the document, this term is highly highlighted, 三医协同, which is what Chang Liu earlier said, 医保, 医药, 医疗. But those are three functions. But behind those three functions, there are like 6, 7 government of ministries. It's how do you get them to really coordinate? I do think that is going to be a major effort that we're going to see. Is it going to be successful? It remains to be seen. But I think a lot of effort is going to be on that.
Very good. Well, thank you. Thank you very much, Professor Yip. Certainly, there's a lot going on in China today on the public health front with this new attention from the senior officials, from the long-standing effort to advance the Healthy China 2030 goals, from the involvement of the China in the global health partnerships, to the increasing interest from the overseas and global healthcare industry players. There's really a lot going on, but I'm afraid that's all we have time for today. And I want to thank all of you very, very much for joining us for what's been, for me, a really terrific and informative, interesting discussion. So I want to thank you all again, and look forward to seeing you again soon.
Thank you, and good seeing all of you.
Thanks, everybody. Bye.